clap and hold a microphone and read some notes at the same time. But good afternoon and welcome. My name is Kathy Glosson. I'm a registered nurse of over 25 years, as you can tell from the reading glasses. And I'm proud to serve as the president of SEIU Local 199 here in Iowa, representing over 2,000 healthcare professionals here at the University of Iowa hospitals and clinics. You know, I can't think of a more appropriate place to talk about healthcare and the need for healthcare reform to make sure that every man, woman, and child in this country is covered with some sort of health care. And what better place than this beautiful medical research facility to have this discussion, right? As a registered nurse, I know firsthand, I've seen it. I've been a nurse for over 25 years. I've seen the effects that an ailing healthcare system has had, not only on my patients, but on the nursing profession. For those healthcare providers here in the room this afternoon, are there other healthcare providers here? I know there's probably some students that are studying to be healthcare providers. I know you're out there, aren't you? Healthcare providers, yeah. This is how I would describe, in short synopsis, a nurse's description of our nation's healthcare system. Well, our nation has a weak, thready pulse, and it's not going to survive much longer unless we call a code blue and begin emergency efforts to save it. And that's exactly what the 1.9 million members of SEIU plan to do. For those of you not familiar with SEIU, Service Employees International, we're the largest healthcare union in the country, representing more than 1 million healthcare workers, and we're very proud of that. SEIU here in Iowa, along with Iowa for Healthcare, you see the healthcare voter signs here in the room, we have really succeeded in making healthcare the issue, the bread and butter issue that Iowans are discussing at their breakfast tables and dinner tables across the state. And we will not rest until we've succeeded in our goal to make quality, affordable, accessible health care made for every single man, woman, and child. And now I want to talk about somebody else that thinks the same way we do. John Edwards. John Edwards is no stranger to this fight, and he's no stranger to our union. Heck, we've been dealing with him in Iowa for the last 4 years. He's been a tremendous help to our members struggling to form unions. He's made the fight for working families his own fight. He's marched on picket lines, attended dozens of rallies in support of workers' rights across the country. He's worked with unions, community organizations to pass minimum wage increases across the country. John Edwards has demonstrated a willingness to stand up for the interest of Iowa's working families against the onslaught of corporate lobbyists, when others tended to be more cautious and politically calculated in their positions. I'm proud, and I believe the people in this room are extremely proud to stand with him today. We pledge to do everything in our power to ensure that he ends up in the White House. That's why SEIU Iowa today is so extremely proud to announce our endorsement of John Edwards for President of the United States. I'm proud to stand here today with SEIU Iowa members standing here with me, some of them behind me here, who are some of the most informed healthcare voters in the country. And it gets even better. With SEIU members from across the country who join us